Welcome. This event is sponsored by the Bringing Recovery Supports to Scale Technical Assistance Center Strategy. Most of you know us as Brass Tacks. I'm Cheryl Gagne. I work with Brass Tacks. I'm a senior associate here at the Center for Social Innovation, and I'm going to be the moderator for today's event. We'll be talking about medication as an option for people seeking recovery from opioid use disorders. We're going to talk about ways to get information, and we're also going to be demonstrating, presenting a new online resource called the MAT Shared Decision-Making tool that is helping people engage in conversations and decision-making about whether or not medication-assisted treatment is right for them, and if so, which medication-assisted treatment option is best. I want to thank you all for posting, responding to the poll question. I don't think we're up to 100% of everybody doing so, but we've got a good sense. There are a number of peer specialists in the program, recovery coaches. We have a lot of people in recovery, a lot of providers, and then I like the way many people have typed in other where else they're coming from. So thank you so much for answering. Today's event, the style that we like to use is lots of participation from you. And as you can see, the box far to the right where it says post comments, you can type right in there. You may see people you know who are also on the call today. We're going to have about 3 more polls, and we hope that you'll participate. It really helps us understand better who is listening in. At any time during this whole hour, you can type comments or questions into that chat box. It's called post comments or questions here. Before we begin, I would like to introduce an exciting capacity building opportunity that is available to you through Brass Tacks. There's information about this in the web links. You can get more information. It's under Pro RCO Capacity Building. If you click on that, you'll get not only more information, but the actual application. So this is another opportunity that we wanted everyone to know. You can see that applications are due February 15th, so now's the time to learn about it. We're going to be pulling in another poll question that asks you about what your experiences are with medication-assisted treatment. So I'd really like to get a sense of who is on the call and their relative comfort or familiarity with medication-assisted treatment. And while you're answering, I want to introduce these other 2 faces on the screen, my dear colleagues, Wayne Centrone and Stephen Samra. They will be doing the actual presenting today, and we'll give them an opportunity to introduce themselves right before their presentations. Before we dive in too deeply, I want to do a couple of housekeeping items. Today's session is being recorded, and we will archive it. It will last about 1 hour. So if you're listening to this and you think your organization might need technical assistance around this or just want more information, you can go ahead and download the Brass Tacks TA form in the Files for Download pod, which is now it's called Web Links on the left side of your screen. During this event, all of you are in listen-only mode. We believe there are about 1,000 people on the call, so it would be pretty chaotic if all phone lines were open. So you're in listen-only mode, and we really encourage you, as people are, to submit questions, comments at any point in the box. If you experience any technical difficulties, please request assistance in the comments box. We'll respond to you right away. As we ask that you listen to the webinar using your computer rather than a phone line. If you have any technical difficulties, audio difficulties, there is a phone number where in this audio instruction pod that you can go ahead and call in. One more important thing, when we close the room the end of the event, automatically they'll pull up a satisfaction survey, and would appreciate if you could take a minute, and it is about a minute, minute and a half, to complete the survey, since your answers really help us, do a better job next time. A link. And with that, I think that's all the housekeeping. Let me just say who is in terms of familiarity with MAT, people's experiences. A fair number of people are service providers with people who use medication-assisted treatment. Number of current or former, people who've used MAT, friends and family. So it's great to have all of you with us today. And with that, I will turn it over to Stephen Samra from Brass Tacks. Stephen.
Cheryl, thank you so much. And hey, everybody. It's really great to be here. As Cheryl said, I'm Stephen Samra. I'm a deputy director with the SAMHSA Brass Tacks Project, but I'm also a person in long-term recovery from trauma, homelessness, criminal justice involvement, mental health challenges, and in long-term addiction to opioids. It's really terrific to be here today, and I'm excited to explore medication-assisted treatment, shared decision-making tool with every one of you. I think it has great value, and my colleague and friend, Dr. Wayne Centrone, is going to walk us through this incredible tool shortly. But before we really jump into those specifics, I participated with Wayne in the original structure of this, and I was very passionate and excited when we were developing this. And I want to share with all of you why this particular piece of work is so important to me. 42 years ago, it's a long time ago now, and I still remember it like it was yesterday. I was at the kitchen table at a friend's house. I was 14 at the time, and I was playing the card game Uno with a group of friends. Somebody at that table began passing around a bottle of Tussonex cough syrup, and all of us were taking drinks from the bottle. I had already been experimenting with cannabis and some other drugs back then, but when I drank the cough syrup and I experienced that narcotic euphoria for the very first time, again, it's like a flashbulb moment for me. I can still to this day find myself like right back at that kitchen table, and I can remember thinking, this is exactly the kind of feeling that I was searching for. Now, like so many other people who become addicted to opioids, I did get my initial start on prescription pain and cough medications. And I eventually ended up raiding the medicine cabinets of my friends and family. And then I graduated to facing some, painful illnesses, and I figured out how to weasel prescriptions out of physicians. And it wasn't long after that I found a couple of unscrupulous pill doctors, and pretty soon I had more opioid painkillers than I knew what to do with. I knew what to do with them. That was where the problem was. Now, there was a major shift away from prescribing opioids in the 80s and 90s. And as my legitimate pill connections began to disappear, I turned to the street to purchase opioids. Although I was still using pills, they were very costly, and they were often very difficult to find. Strangely enough, however, heroin seemed to be everywhere, and it was both strong and relatively cheap by comparison. Finally, I was pill sick one day. I couldn't locate any pills, and I injected my first dose of heroin. After that, I pretty much never bothered the pills, doctors, or the legitimate procurement of opioids ever again. My addiction challenges, coupled with mental health challenges related to serious and complex trauma as a child, they caused me great havoc in my life over the next 30 years. And in the 90s, fresh out of prison for a marijuana drug crime, I was ordered into treatment. Now, I'd been trying to stop taking opioids for several years at that point, and I've never been successful. Part of my court-ordered treatment included attending 12-step meetings, and I really jumped into that program with zeal. While I was in the program, I relapsed repeatedly on opioids, and the shame became almost unbearable to face when I had to share that at meetings. And I can still recall discussing some of my consideration, this idea that maybe medication-assisted treatment and methadone would be beneficial to me, and I shared that with the group, and that didn't go over really well. I was frankly met with more shame, and a lot of the arguments that are put forth by people who Honestly, I think were really vested in my well-being, but they were simply uninformed about medication-assisted treatment. And some of those comments included, hey, you're just replacing one drug with another. You can't attend meetings under the influence of dope. That experience and those experiences actually kept me from entering medication-assisted treatment for almost 3 additional years, because many of the falsehoods about the MAT program perpetuated in those meetings, and frankly elsewhere, stayed with me. They were really powerful. Now, before I go any further, I'm going to say right now that 12-step programs help a whole lot of people. I'm a huge supporter of them, and any route to recovery is a good one. So I am definitely not here to disparage 12-step programs. Instead, I'm sharing my personal experience with 12-step programs as it relates to medication-assisted treatment, because the very people I felt a kinship with, this community of people with similar lived experience, they were now ostracizing me. And that was a really painful and lonely place to be when you lose the only community that you've ever felt you were really a part of. And the truth be told, I then ended up using more opioids to kill the pain of the loneliness and shame heaped on me by my own brothers and sisters. Thankfully today, the vast majority of 12-step programs recognize multiple pathways to recovery and the efficacy and value of medication-assisted treatment. And they realize that methadone and Suboxone, rather than being one drug replacing another, are indeed effective medications to help combat opioid addiction. This is a critically important distinction, and the one that many of us with addiction histories, myself included here, often fail to miss, at least initially. So the sharing of my experience here is simply meant to buttress the growing acceptance of MAT as a legitimate and viable pathway to recovery. This experience with the 12-step program also had an impact on how I entered the medication-assisted treatment program. I could no longer go to people who were sober and living in recovery for guidance, support, and information, since they didn't believe MAT was a viable pathway to recovery. Instead, I turned to those people I knew were using methadone to address their own opioid addictions. Now, there was so much misinformation flying about in that cohort that I frankly would have been better off just showing up at the clinic and hoping for the best, which in many ways is exactly what I did. Now, back when I began MAT, there was only one drug, that was methadone, and there wasn't a lot of effort on the front end by clinic staff to help an individual make determinations about how they wanted to use it. Because of that lack of information, I made some choices early in the program that, although I really don't regret them at all, had I had access to the tool we're sharing today to help me think it through, along with some competent professionals and, importantly, a MAT knowledgeable recovery coach or certified peer specialist at my side, it may have made the experience easier, clearer, and better overall, not to mention feeling supported and valued as a human being. Now, as I close, let me share that I'm absolutely convinced, after 3 major overdoses with opioids, that without medication-assisted treatment, I most certainly would not be here today, and frankly, I think I'd be lucky to be alive. My hope with the introduction of this tool is that no one has to be alone in making decisions about entering the MAT program, that those of us who provide treatment and support to people like me interested in exploring MAT will have a greater, deeper, clearer, and more compassionate understanding of the value and benefits of MAT as a pathway to recovery. And that ultimately, anyone who needs our help is able to quickly and easily get it while surrounded and supported by their brothers and sisters in recovery. With that, let me turn this over to Wayne so you can all check out what we've developed. I thank you all for letting me share today, and I would be very remiss if I didn't include a massively huge thank you to Samra for providing us with this ability to make this tool a reality. Wayne?
Stephen, thank you so much. It's always so good to hear from you. Before we get started with the show and tell portion of this Recovery Live, let's go to another poll. How many of you are familiar with the concepts and practices of shared decision-making? And how many of you incorporate shared decision-making or SDM into your work? I'll give you just a few minutes to begin to respond to those questions. I'm going to share my screen, and in doing such, I hope to give you a brief opportunity to learn a little bit more about this tool that was developed through the Substance Abuse Mental Health Services Administration under the Bringing Recovery Supports to Scale Technical Assistance Center strategy. Before I begin, I should very much mention that I have no relevant disclosures. I am not a paid employee or staff of the pharmaceutical industry, nor was this tool, Decisions in Recovery, developed with any drug company money. Okay, now that we have that important information out of the way, I was fortunate to be the project director on the development of this tool. My background is in family medicine, and after leaving my residency, I went to work at an inner-city federally qualified health center on the West Coast. I was evidence-based services and supports to the patients I was called to serve. A number of the patients I worked with were living with very complex co-occurring medical conditions that could not simply be addressed with a prescription pad or a single therapeutic modality. The patients I was fortunate enough to work with needed comprehensive, integrated services. And this challenged me to find the time to work with them to better understand their options and the impact of a treatment decision. It was with this that I was brought to the concept of shared decision making. Look, information that is truly helpful needs to be personalized and actionable. By that I mean information needs to be accessible to our needs and our place in a broad continuum that is life and life decisions. And every meaningful event or decision happens in the confines of relationships. This tool, this resource is about helping people to connect with the information and relationships they need to foster a recovery path that best meets their life needs. Before I go any further, I need to say a very special thank you to Captain Wanda Finch of SAMHSA's Center for Mental Health Services, the brass tacks contract officer representative, whose leadership helped to make this tool available to the public. And a very special thank you to my great colleagues from Advocates for Human Potential, Ms. Lori Curtis and Ms. Nikki Miller, without whose help this tool would not be possible. And finally, to the brilliant Dr. Lisa Mitzler from Dartmouth University Geisel School of Medicine for the tireless and focused attention to defining the research and the evidence base for this tool. You'll note that I keep using the word tool, and that's really it. Decisions in Recovery is a tool from the Old English told, or to prepare. It's a mechanism that helps us prepare for something, a change, if you will. In the case of Decisions in Recovery, the tool helps a person in or seeking recovery from an opioid use disorder identify the information and understand the what next of a decision. Decision support tools help both providers and patients share information about options, preferences, and next steps. They structure dialogue about direction and enhance communication, and help to focus treatment and decision-making. Look, people make decisions best when they have the information they need to make a decision that is matched to their needs and their life goals. In essence, the shared decision-making tool or decision support tool helps to change the conversation about what next and how. It's with this in mind that we developed Decisions in Recovery. This tool is built on three simple questions. Should I start? Which do I start? And how do I start? Decisions in Recovery was a 5+ year effort. We visited a number of agencies and programs, met with some of the brightest and best minds in medication-assisted treatment around the country, including the phenomenal advocate, Mr. Walter Ginter, and his team at the MARS program, the Einstein School of Medicine in the Bronx. And what we learned over and over again was this: opioid use disorder is a brain disorder and not a thought disorder. And just like treatment can be defined and provided in an evidence-based way for medical conditions, it can be prescribed for opioid use disorder. And the pathways for people accessing and engaging MAT are varied and unique. As such, we were challenged to build this tool in a way that offers, as the great William White once said, no wrong door to recovery. Through field testing at opioid treatment programs, and hospitals, and clinics, syringe exchange programs, harm reduction centers and programs, we found a structure to develop the tool. So here we go. Let me walk you through the tool and give you a brief overview of some of the features and the notable elements. However, if you have questions or comments or need clarity, feel free to contact us at the Brass Tacks website. A few things that I'd like to make you aware of as we walk through the tool. One, again, this tool is not underwritten or subsidized in any way by pharmaceutical industry funding. We develop decisions in recovery for people in and seeking recovery from opioid use disorder. As such, it was developed by people in recovery with the support of a team of researchers, consultants, subject matter experts, and federal reviewers. It is a tool firmly focused on recovery. We tried to write it in a non-jargon, easy-to-understand way, and we pulled in the evidence wherever it was. This tool is designed to assist the person to really answer the question whether medication-assisted treatment is right for me. Here listed as, should I start treatment? And in that, we developed layers of responses to questions, recognizing that for some people, they might want just the initial layer of information. And that initial layer of information takes them to video tutorials and general information about why is it so hard to stop using opioids? How do people stop using opioids? And then what are my personal reasons for stopping using opioids? As a person chooses to get further into the discussion, they can find more and more layers of information about opioids and pain, about why people do start or even stop using, and then how to find resources. Additionally, the tool helps walk people through what is medication-assisted treatment, and how can medication help me in my pathway to recovery. Each of these questions is layered with a response of information that can allow a person to go as deep or as shallow as they want to gain better understandings of medication-assisted treatment and how MAT fits into a recovery plan. There's also tools, and you'll notice that we call these treatment tools, and they help to walk a person through what next. Can I truly begin the process of recovery, and what will that look like for me? What are some things that I need to be mindful to? What are my personal and familial attitudes and beliefs toward recovery? Now, I should say right from the very beginning, this tool is built on the essence of confidentiality. So there's no cookies, so we're not gathering any data on any users of the website. All of the information that is provided in these tools, these worksheets, is not saved. So the minute a person leaves the website, there's no trace of them actually going on the website. However, if they chose to print this form, they could print this form and email it to a provider or email it to themselves or turn it into a PDF document and save it on their own hard drive. But none of the information that's collected is stored. So the minute you leave the website, the information that you put into these worksheets is gone. The other critical question that Decisions in Recovery is built on is, which do I start? If indeed I decide medication-assisted treatment is right for me in my pathway to recovery, what do I start? Of the 3 licensed medication-assisted treatments in the United States, methadone, buprenorphine, and intramuscular naltrexone, which one is best for me in my personal pathway to recovery? And how do I decide? So we laid out information that, again, allows a person to go through information as it meets their needs, from initial information that is very video-centric to deeper levels of information that talk about risk and benefit and side effect and cost and risks. equally for all three of the medications, methadone, buprenorphine, and naltrexone, we established a comparative table that allows people to look at the medications in a side-by-side manner. It allows them to understand what is methadone best for, buprenorphine or naltrexone, and look at these responses in a way that they can begin to make decisions in partnership with their providers. The next question answered by the tool is, so if medication indeed is right for me and my personal pathway to recovery, how do I get started? And how do I get started on a pathway to recovery? Which means, who do I need to talk to? How do I find a provider? What can I expect in that initial medical encounter? How do I build a team of recovery and recovery supports in my life? And how do I plan for success? There are equal layers to this tool that provide just general information about recovery and recovery stories. So as a person goes through the tool, they should be able to find information that's specific to medication-assisted treatment and use of MAT in a recovery pathway, but general information about recovery and planning for recovery for an individual, and using the worksheets to help to create a recovery pathway. Finally, we've taken all the recovery tools and put them into one where people can go through and look at the different worksheets and download those worksheets and begin to work through the questions and some of the thought-provoking discussion that will occur with those worksheets. We also put in a variety of different resources that makes it easier for a person to understand how all of this information might fit into their life. So the tool is designed to assist a person in a discussion. It's critical to understand that this a patient, a person in recovery, a provider, a therapist, a counselor, to really begin the process of deciding what's next and how do we support each other in that process. There are brief videos of recovery stories that provide a range of views, lived experiences from persons in various stages of recovery. There's downloadable worksheets to assist individuals. There's also a companion handbook that's available on the SAMHSA store and can be downloaded as a PDF document. This concept of shared decision-making ultimately is about helping a person begin the process of making a next step in their life. And what we've done is pulled together as much information as possible. Thanks to Dr. and her work, we have fastidiously developed bibliography of resources that provide the evidence backbone for this tool, and a number of helpful links that can be really beneficial to both a person in recovery and a provider. So there's a whole nother section to the tool that was developed for providers. It's not password protected. Anyone can get on that side of the tool. And it helps to walk providers through, how do I use this tool in the clients that I'm working with, in working with people who are at the initial stage of deciding whether medication-assisted treatment is right for them, or understanding what shared decision-making is for my own practice. And again, just like the side of the tool that's focused on people in recovery, this side of the tool has layered levels of information. And a person can decide to go very deep into the information or shallow into the information. And our hope with this, just like any of the other resources that's available, is that it can stimulate conversation for providers and help them really think through how MAT fits into the services they provide. So in field testing, we ask providers and people in recovery, program administrators, how would you think a tool like this should be used? And what we got in response was extremely informative information. That people can use this before appointments, they can use it during appointments, they can use it after appointments. It can be used in workshops or groups. It could be used by peer support providers. It could also be used in professional development. And what we've tried to do is lay out essentially a step-by-step path to help people do that. Our team carefully considered how decisions in recovery could be used as a framework for integrating a recovery approach to a shared decision-making and MAT. This tool is a blueprint of sorts to help programs and providers carefully consider how they can best support people in recovery or seeking recovery from an opioid use disorder. Our hope is this tool can be used in conjunction with efforts that are underway by SAMHSA and other federal agencies that bring a comprehensive approach to addressing the opioid challenges that are facing so many people in the U.S. and around. Before I end, a couple of parting thoughts. First, there is a robust level of evidence for MAT. In fact, we've compiled a substantive bibliography for the referencing of the information and data presented in this tool. In addition to defining the academic justifications for decisions in recovery, let me make a special nod to the elephant that can undoubtedly creep into the conversation about treatment and supportive services. As a researcher and developer, a big consideration for me was the issue of bias. We did everything we could to minimize the influence of confirmation and selection bias in this tool. Is this tool perfect? No. Did we work very hard to ensure that this is a bias-free resource? Without a doubt. However, as you look through this tool, if you see things that you think might be introducing bias, please contact us and let us know. Finally, this tool is a resource, and it's meant to be used in a dynamic relationship. Peer providers, prescribing providers, therapists, counselors, and people in or seeking recovery can use decisions in recovery to advance a conversation or expand communication. This is not an informational website, but a shared decision-making tool that invites discussion and discourse. Our hope is that people can use this resource to help them engage and build the life they so truly deserve. With that, let me turn you back over to Dr. Gagne, who can help to transition us into a few of the great questions and comments you've been posting in the chat boxes of this Adobe Connect room. Thank you for allowing me to give you a brief peek into this powerful tool. And a huge thank you to all of the people who contributed their time, energy, and expertise to the development of decisions in recovery. Finally, thank you to all of you for your tireless efforts to support people in recovery from opioid use disorder. You are saving lives every day, and our hope is that decisions in recovery can be a complement to the amazing work you are already doing. Cheryl?
Oh, great. Okay, thank you so much, Wayne, and thank you, Stephen. One of the biggest questions is, where can I get this tool? That's been coming in through the box as soon as you began your presentation, Wayne. And because the slides were up, you couldn't see the web link. So you can see now at the right hand of your screen, the MAT Shared Decision Making Toolkit is the link that will bring you directly to the tool in the SAMHSA store. It's called a store, but it's free. Unlike most stores, most of the materials in there are free of charge. We encourage you to use it, in a variety of ways. There was a question about, is this an evidence-based practice? And Wayne, I'd like you to speak to that a little bit. Is this tool considered by SAMHSA evidence-based was the question, and we'll kind of take it from there.
That's a great question. I appreciate that question, and I wish there was an easy response to that question. What I can do is tell you this. Medication-assisted treatment is squarely an evidence-based practice. There is a robust academic literature and very well-developed research studies on the evidence and efficacy of medication-assisted treatment. That should be without question. The use of shared decision-making to help people to access and utilize medication-assisted treatment is not an evidence-based practice. We are hoping that someday that can be validated as an evidence-based practice, but MAT and shared decision-making as a process are not evidence-based practice.
Clear? Is not, although MAT certainly is. And shared decision-making processes are in other branches of medicine. And so that's an important thing to keep in mind. And I think, as we use it, if we can share our experiences with each other, and we can only strengthen the tool itself. Other questions, or a lot of comments coming through about 12-step programs. Cindy clarified for us, AA does not take a position on MAT. People on MAT, that's between them and their doctors, and they are people in recovery. However, that attitude, despite that letter coming from, AA Central Service, that attitude may not permeate every meeting. There was a question, are there other programs of recovery that might be more accepting of people using MAT? And Stephen, I think I'll turn that to you, and Wayne, you may have something to say about that.
Yeah, thank you, Cheryl. There are support groups, and there's some methadone groups. There's a great group on Facebook that NAMA, the National Association of Methadone Alliance, and I may have that wrong, and I apologize profusely to Zach Talbot and Joycelyn and the NAMA team. But they have a fantastic website or Facebook page that is really addresses all of the issues related to methadone, Suboxone, Vivitrol, naloxone. It's a great source of information, and I've found a lot of support there. But, I want to take us back to the 12-step and the AA and NA, and because I think, honestly, we've been dealing with this now for, at least the last 7 years, where I know that there have been this, this tension between sort of national level leaders around understanding the multiple pathway approach. And I think NA and AA are really catching on to that. This letter coming from the AA headquarters is really, really important. And as Cheryl said, it hasn't permeated all the way through down to every single meeting. That stuff takes time, and it takes us to, particularly those of us who are in a medication-assisted treatment program, to stand up to that. And I don't mean that in an offensive way, but I mean that in a raise awareness, education way that provides the understanding that this medication is between me and my physician, and I am remaining abstinent from illegal drug use. And I feel like, what I don't want to see happen is a further delineation between subgroups of people who are all trying to enter into recovery and trying to achieve health, home, community, and purpose. SAMHSA's 4 domains around, what is required to live a satisfying and productive life. So wherever possible, I think our role as advocates, particularly, is to raise awareness about the efficacy of medication-assisted treatment, and to make sure that all of us recognize that, each one of us needs our own unique pathway into recovery. Whatever that pathway is, it should be available.
Great. Thank you, Stephen. And as you were presenting, Stephen, others have recommended, Methadone Anonymous offered at some clinics, all recovery meetings and smart recovery meetings, which may be less, there may be fewer barriers. Linda also mentioned that many recovery housing providers are resistant to MAT, and I think that goes along with what you were talking about, Stephen, about really kind of, educating and promoting and helping people understand the real benefits of MAT for people with opioid use disorders. Someone mentions that, in Richmond they're having a lot of success with MAT in their drug courts, and it wasn't that long ago with drug courts sometimes put up a barrier against MAT, and judges were saying you can't be on it if you're in my court. So I think we're moving the dial in terms of acceptance. Yep, go ahead, Stephen.
Yeah, I just wanted to chime in one more time because this is a call to action for those of us who have experienced, either methadone or Suboxone and who have are either a current client, a current patient, or who have successfully detoxed off after a period in medication-assisted treatment. I really feel this. We have a duty to stand and model our recovery. And I wear this on my sleeve all the time. And I take some hits for it at times. There's still a lot of stigma and shame out there. But I think that we have a duty to promote the success of medication-assisted treatment by simply modeling our recovery, our behavior, our employment, our relationships, and the standing that that we have in our community today. Thanks.
Yeah. Thank you, Stephen. And I see there's a lot of discussion now about how to go about that. How have you changed things in drug courts and in recovery housing? Rational recovery was also mentioned as an option for people who want a group support intervention for their own recovery. A couple people have posed questions or requested we discuss the use of marijuana in some states that is being used to help people with opioid use disorders. Are there any comments or that you want to make on that? Any knowledge of that?
Well,
here's a landmine.
I don't. Yeah, I don't know of any evidence base for the use of marijuana as a medication-assisted treatment for opioid use disorder. I don't. It might be used anecdotally. I can't comment on that. But what I can tell you is there is an evidence base for the use of methadone, buprenorphine, and intramuscular naltrexone. And in this country right now, we are facing a massive opioid use disorder problem. And with the evidence that we have, it seems unfair and unethical for us not to be using this as a treatment. We would not withhold insulin from a patient who has diabetes, and we cannot ethically withhold medication-assisted treatment from patients who have the diagnosis of brain disorder that is opioid use disorder. So just from a purely efficacious and ethically driven, from a medically ethically driven perspective, this is an evidence base, and we have to use the treatment. I'm sorry, I went a little off subject, Cheryl.
No, I think that's an important message to come back to again and again. These are not ordinary times in terms of our difficulties with opioid use disorders and the incredible overdose crisis that we're facing. This is the elephant in the room that I find all the time, and this is, let me see if I can find it. What do you say to... Okay, what are your thoughts about people engaging in MAT so that they can sell their MAT drugs to support their addiction? How do you tease out these individuals?
So let me talk a little bit about that.
Okay, Stephen, and then I will. Go ahead.
Yeah, so, I mean, when I first started in a clinic setting back in 2000, I can remember getting all my doses, and at the time I was on tabs. And I was, I think about 2.5, 3 years in, I went to monthly take-homes. And I remember getting all my take-homes in one big bottle. And there was no diversion control. I did not have anybody drawing peaks and troughs. I didn't really have any of that sort of oversight on my medication. And over the course of, the next 10 or 15 years, I watched a lot of changes occur. And I have to be honest. I mean, I know that it happens, and many of us come with the street background that we do not ever want to be sick again, and that the medication-assisted treatment program is our priority. And money is often tight for us, particularly early in recovery. We're still struggling. We still have daily crises, and it's a battle. But it's becoming increasingly more difficult to pull that off. And frankly, it really rests not so much on the provider and law enforcement and the folks who are doing that. It rests on those of us who enter this program with the idea and the vision that we are going to achieve recovery. And we have to take some personal responsibility for that. Again, I recognize that, there are a lot of challenges that come our way that can't even be, understood by most people. But ultimately, we have a responsibility to ourselves. And this is something that I was talking about early on when I said the difference between drugs and medication, and that there's a distinction there that many of us who, are early in the clinic fail to connect. And this is our medication. This is not a drug that we're using to get a buzz with. And so having said all that, again, we have this duty to each other that if we're entering into recovery, we need to be serious about that recovery, and we'll allow our diversion control in the clinic procedures to help us manage that. It's difficult. I get it.
Thank you, Stephen. I think, too, working in the public addiction treatment setting, we tend to see people who are the most disabled or impaired at the time when they're most impaired and most disadvantaged. And so we see it, and that becomes our image of, like, all opioid use disorder is like this, when in fact there are vast majority of people on MAT use it properly, use it to recover from opioid use disorder. We just don't tend to see them all the time because, well, our repeat customers are those who are in a point in their lives where they're needing a lot of intervention and a lot of support. And so it might color our whole view of what MAT is. They call that the clinician's illusion, that belief. And so we need to, really read the research and get to know what the benefits and outcomes of MAT can be for many, many people. People are going to differ in their readiness to use it well, differ in their readiness to be fully committed to recovery. And so as providers, we really need to focus on helping people develop that readiness so that they can use MAT well and recover from opioid use disorders. So that's my 2 cents. And there's a question here, is this Wayne C. from Oregon? I guess it is. Okay. All right. There was a question, a comment about kind of polypharmacy, and Wayne, I think I'll give this to you. And how do we educate people, and is it part of the tool about the dangers of kind of mixing medications and cocktailing on MAT? She's cocktailing in air quotes on medication-assisted treatment.
Yes, it is a component of the tool. There's reference there specifically around the use of benzodiazepines and medication-assisted treatment. And there is a massive level of push from the American Society of Addiction Medicine and a lot of physician-focused education groups right now to really train providers on the appropriate use of MAT as well as the appropriate use of narcotic analgesics and the, as it was defined in air quotes, cocktailing of different preparations. Certainly there is a danger associated with, an absolute danger associated with the use of benzodiazepines and medication-assisted treatment. And that's well described in the literature and well understood by prescribing physicians and providers. And the hope is that there'll be a greater push, ASAM is working on this, to get that messaging out to the wider public.
Yeah, very good. All right, I encourage you to go ahead and put in your questions because we only have a couple more minutes for questions. Another question about the tool. Could you see this tool being used in a group process or in group level?
Yes, as a matter of fact, part of the tool that we even tried in some field testing was to see could it be used with peer-run groups. Could the tool be brought up on a monitor, and could a facilitator walk through specific sections and use those sections as guiding questions? And what we found was most certainly, and with very little in the way of training for peer facilitators, the peer facilitators are so knowledgeable that simply giving them the tool, giving them time to work through the tool, and we did some testing where we put people into a room and gave them computers and said, play with the tool. give us your feedback on the tool. They quickly were able to navigate through the tool and even pull out ways that they thought they could use it differently. Definitely. It could be used in group or in one-to-one peer or provider-related sessions.
Great. Thank you so much. And what about technically? Is it mobile phone friendly?
Yes, it is. Yes, it is. So it will render the same on your mobile device, tablet, computer, as well as on your smartphone.
Yeah. And Katie, it's not currently an app. It is a web-based tool, but it can be used on the on a mobile phone. So there is no app right now. Let's see. Let's see. Any other questions about the tool or about medication-assisted treatment? Yeah, someone mentioned I might not be inclined to read the, the booklet that assembles it. Is it possible to use without having to sort of dive in deep with reading?
Yeah, that's a fantastic question. Thank you. That is a really great question. The way that we designed this was the handbook is a companion to the website. So if, for example, you couldn't get online, you could just download the handbook and it would provide the same content, laid out a little differently, but the same content that you would get on the website. However, if you went on the website and you didn't necessarily want to get into the information, you could get most of that information through video. There are enough video elements that we tried to lay in this sort of, if I watch a little bit of video and I read a little bit, am I going to get the same? Yes. We tried to make it as user-friendly as possible and to have as many different ways for a user to come at the information.
Okay, great. Thank you. And what reading level would you say? What reading level were you shooting for with the tool?
We were shooting for the 6th grade level. Some of the information is pretty technical. I can tell you there are certain segments of the handbook as well as the site that are at the 8th grade level, but our goal was to have it at the 6th grade level.
Great. Thank you. There were a couple of questions about pregnancy, and is it recommended that a woman be on birth control if she's going to use MAT?
I would say that's a great question to have with your clinician or provider. Mm-hmm. There is information on the tool that talks specifically about MAT and pregnancy. Yeah. There's a whole section. Yeah.
And in fact, MAT is required for women with opioid use disorders who become pregnant. It's a much safer alternative than using, say, heroin, it's much safer than actually detoxing while pregnant. Okay. Very good. All right, I think we will we'll be moving on to our 4th poll question. I'd really like to hear from you. Do you think you'll use this tool in your work? You can go ahead and most people, only a few people have responded. You might need to scroll down a little bit because there's more than 2 options. Okay, you see that. All right. So it's a real mix. Many people are saying, yes, they'd like to use the tool immediately, and we could sense that from some people in the dialogue box. Some people will be using it in training. Many people say that they'll use it perhaps in the future, but not immediately, and maybe need to kind of clear some things up within their organization. Quite a few said, I'm not sure how I'll use this tool, but I really wanted to learn about it. And a very tiny minority said they don't foresee using it in their work, but I'm glad that you participated in the Recovery Live event anyway. Okay. Oh, good question. Rhonda asked a question. Now we're done taking questions, but I think this, how do you get funding for MAT? And I think that's a question, that differs so much state to state and depending on people's insurance coverage, that it's really hard to address. that. However, I think on some of, if you look on websites around funding substance use services within your state, you may be able to find some information on funding MAT. In many states, yes, Medicaid does cover MAT. So all of these questions are important. How to increase MAT utilization, that's something for a future expert panel or webinar. Before we leave today, I do want to ask you for two things. Topics for future Recovery Live events. We'll use this format where we have a presenter or two, very briefly, but turn most of the attention to the participants and getting information that is really specific to your needs. So I want you to go ahead and think about, so there are a couple good things: pregnancy and parenting with MAT recovery, co-occurring disorders, very good. Treating cannabis use disorder. And then finally, before we leave, I want to turn your attention to the, we have one more Recovery Live event coming up on February 23rd. Our very next one is called Defining Your Own Recovery, strategic sharing and recovery messaging for young adults. And we have some great presenters, Lucy Kendrick-Burke, Justin Luke Riley, Juan Velez Court, facilitated by our brass tacks Valerie Gold. So we do hope that you'll be participating on that next event. And again, turn your attention to the capacity building TA opportunity. Please look into that. It's an opportunity for, peer-run organizations and recovery community organizations, as well as family-run orgs. All right. Thank you so much for your participation, your questions, your recommendations for future Recovery Live topics. We're going to say goodbye. Please hang out just another minute and a half to finish the satisfaction survey for us, please. Thank you so much for today. Adios. Bye-bye.